strong clinician for 20 years, and I found that in my clinical practice I had more questions than answers. So research seemed like the perfect vehicle.
I was working as an ICU research coordinator myself and doing an English degree, and I was looking for a way to combine my nursing skills with my writing interests.
I started working in research in 1997, and I was just intrigued, having been a clinical nurse, at the wide variation in clinical practices.
Well, I have a clinical background, and I believe that healthcare interventions in general should be safe, effective, and also cost-effective.
I did an evidence-based practice course at work with Professor Joan Webster, and from there I thought I wanted to do some further studies in nursing, and she encouraged me to do my Masters, and then my Masters led into my PhD, for which I was awarded a scholarship.
Research was really a natural segue for me from clinical practice. I wanted to know why we do what we do and are we doing the best for our patients. And my first research project was a study on patient transfer from critical care that formed the basis of my honours degree.
Well, I guess when I was working clinically as a nurse in intensive care, I saw how we were providing patient care, and we did, I thought, a really good job, but I did think there was areas we could improve on, and so it made me start questioning, I guess, how can we better provide care for patients?
I guess broadly they're acute and critical care, but more specifically, and at the moment, it's IV insertion, care and maintenance.
Much of my research at the moment is looking at clinical interventions that have an impact on distressing symptoms for people, whether that be in hospitals mostly, but I also am doing some research with people in the community.
I'm interested in simple but innovative solutions to normal nursing problems. My background is in paediatrics and in critical care, and at the moment I am looking at how to prevent failures and bad outcomes associated with the care of central venous access devices.
My research interests focus on recovery after intensive care, whether the patients ended up in intensive care as a result of illness or injury. What we're looking for is the things that cause a patient to have problems, and then how we can develop interventions to improve that recovery after intensive care.
My research interests are basically the recovery of the patients who survive after critical illness. So at the moment I'm looking at the emotional recovery, but also the physical recovery of these patients, and long-term outcomes is very interesting for me.
I am a mother of 2 young children, and they take up an awfully large percentage of my time. But I find that working as in nursing research and as a nurse researcher, it provides me the necessary balance and flexibility. I am also very interested and passionate about the work that I do, so I find it easy to go to work each day and enjoy each of my work days.
Well, I'm married and my husband is away working in Perth. I'm a mom, so I have to look after my kids, and research gives me the opportunity and the flexibility to do more than, those 2 things at a time.
My specific interests, apart from my family and being able to attend my kids' sports days, I like to keep myself fit and healthy, so I'm a member of a small tri-club, so I like to swim, bike and run in the mornings and have a coffee afterwards. That's obligatory after a bike ride.
I enjoy working with like-minded people. I enjoy the ability to reflect on my practice and provide evidence to improve nursing practice.
Working as a nurse researcher has provided some wonderful opportunities for me. First and foremost is working with world-class researchers at NCREN, but also being involved in really fascinating research activities.
Research has really helped me develop and realise perhaps previously untapped knowledge and skills, specifically my understanding of research methodology and writing, whether that's to do with proposals, grants, publications or presentations.
My long-term goals are to see the work that I'm undertaking now to evolve into something greater that eventually makes a significant difference to the patient experience, the quality of healthcare, but also the experience of healthcare workers.
I would love to go into a healthcare setting and find somebody doing something in their normal clinical practice that I have helped contribute to. So an innovative solution to something that was previously not done well, and to see it just being part of everyday practice, just the way we do things here.
My long-term goals are to make a difference in patient care. So it would be fantastic to see my research being used to inform care and patient outcomes.
It really comes down to the people. I have worked at Griffith for the last 4 or 5 years, and I saw how much I have to learn from the staff and the academic staff and the senior research fellows, the professorial staff, and I just saw completing my PhD here was just a great opportunity to learn from them.
I chose to undertake my PhD at Griffith University because of the very high calibre of supervision within the School of Nursing. I found the experience very supportive and in many ways empowering.
I really enjoy supervising students at Griffith because there's so much support. I've met so many wonderful students, and it's just been a really positive experience.
I'm keen to pass on the positive experience that I have had during my research degree and research development, and I like fostering a spirit of inquiry with students, and supervision is a great platform for that.
I really like working at Griffith. I think we have a fabulous team. What I particularly like is that our research is really patient focused. We're really trying to make improvements and changes that will do the best for patients and nurses at the bedside.
Well, Griffith supports world-class research, and it's patient-centered, multidisciplinary, and is going to advance nursing practice in Australia and beyond.
We have a very large and very dynamic team working out of Griffith University, but in partnership with hospitals around Australia and clinicians and universities around the world. So we have a very multidisciplinary approach. We work with nurses and doctors from intensive care, from chemotherapy, nutrition, emergency department.
By coming to Griffith, I have the best supervisors and the best access to current knowledge and being able to develop myself as a student and my future career.